Deafblindness is a combination of sight and hearing loss that affects a person's ability to communicate, access information and get around. It's also sometimes called dual sensory loss or multi-sensory impairment. A deafblind person won't usually be totally deaf and totally blind, but both senses will be reduced enough to cause significant difficulties in everyday life. These problems can occur even if hearing loss and vision loss are mild, as the two senses work together and one would usually help compensate for loss of the other. Signs of deafblindness. Deafblindness most commonly affects older adults, although it can affect people of all ages, including babies and young children. In older people, it may develop gradually and the person themselves may not realize their vision and/or hearing is getting worse at first. Signs of a problem can include needing to turn up the volume on the television or radio, difficulty following a conversation, not hearing noises such as a knock at the door, asking others to speak loudly, slowly and more clearly, needing to hold books or newspapers very close, or sitting close to the television, difficulty moving around unfamiliar places. If someone already has either a hearing or vision problem, it's important to look out for signs that suggest the other sense may be getting worse too. What causes deafblindness? There are many potential causes of deafblindness. Some babies are born deafblind, but in many cases the hearing and/or vision loss occurs later in life. Causes of deafblindness include age-related hearing loss, genetic conditions, such as Usher syndrome, an infection picked up during pregnancy, such as rubella, German measles, cerebral palsy, a problem with the brain and nervous system that mainly affects movement and coordination, eye problems associated with increasing age, such as cataracts. Living with deafblindness, a range of care and support services is available to help deafblind people. Each deafblind person will have a different level of hearing and sight loss, which means they'll have their own individual care needs. The general aims of care for a deafblind person are to preserve and maximize any remaining sight or hearing the person has. This could involve treating underlying conditions like cataracts, wearing glasses or using a hearing aid. Teach alternative methods of communication such as hand-on-hand signing or braille. Help retain or develop as much independence as possible, for example, by training the person to use a long cane, a guide dog, or offering a communicator guide. Your local authority should arrange an assessment to determine exactly what care and support is needed. Signs and symptoms of deafblindness. A person who's deafblind won't usually be totally deaf and totally blind, but both senses will be reduced enough to cause difficulties with everyday activities. The hearing and/or vision problems may be present from birth, but in many cases one or both problems develop gradually as a person gets older and they may not notice it themselves at first. If someone you know has a combination of the signs mentioned below, it's possible they have some degree of deafblindness and should seek medical advice. Signs of a hearing problem. Hearing loss can occur from birth or may develop gradually or suddenly later on. Signs that someone may have a problem with their hearing include not hearing you if you speak to them from behind, needing to turn up the volume on the television or radio, difficulty following a conversation, particularly if several people are speaking or the person they're speaking to is unfamiliar, not hearing noises around them, such as a knock at the door or the doorbell ringing, asking others to speak loudly, slowly and more clearly, leaning in very close to hear what's being said. If someone already has a hearing problem, for example, they wear a hearing aid or use sign language, keep an eye out for signs of vision problems that could develop. See below. Signs of a vision problem. Vision loss can also be present from birth or develop later on. Signs that someone may have a problem with their vision include problems seeing in low light or bright light, difficulty recognizing people they know, finding it hard to read facial expressions, relying on touch to find and identify items more than usual, needing to hold books or newspapers close to their face, or sitting near the television, difficulty moving around unfamiliar places they may bump into or trip over things regularly, not looking directly at you or making proper eye contact. If a person already has a problem with their vision, for example, they wear glasses, use a cane to get around, or have a condition such as glaucoma or cataracts, keep an eye out for signs of hearing problems that could develop. See above. Causes of deafblindness. There are many possible causes of deafblindness. The condition can either be present at birth or develop later in life. Deafblindness from birth. Deafblindness from birth is known as congenital deafblindness. It can be caused by problems associated with premature birth, birth before 37 weeks of pregnancy, an infection picked up during pregnancy, such as rubella, German measles, toxoplasmosis or cytomegalovirus, CMV, genetic conditions, such as Charge syndrome or Down syndrome, cerebral palsy, a problem with the brain and nervous system that mainly affects movement and coordination, fetal alcohol syndrome, health problems caused by drinking alcohol in pregnancy, deafblindness later in life. In most cases, deafblindness develops later in life. This is known as acquired deafblindness. A person with acquired deafblindness may be born without a hearing or sight problem and then later loses part or all of both senses. Alternatively, someone may be born with either a hearing or vision problem, and then later loses part or all of the other sense later on. Problems that can contribute to acquired deafblindness include age-related hearing loss, Usher syndrome, a genetic condition that affects hearing, Vision and balance eye problems associated with increasing age, such as age-related macular degeneration AMD, cataracts and glaucoma. Diabetic retinopathy, a complication of diabetes where the cells lining the back of the eye are damaged by high blood sugar levels. Damage to the brain, such as from meningitis, encephalitis, a stroke or severe head injury. Diagnosing deafblindness. Deafblindness may be detected soon after a baby is born, or after tests carried out later in life. Speak to your GP if you have any concerns about your or your child's hearing and/or vision at any point. If you're worried about a family member or friend, try to encourage them to speak to their GP. Newborn screening. If your baby is born deafblind, this will usually be picked up during newborn screening. These are a series of checks carried out to see if your baby has any serious health problems from birth, including any problems with their eyes or hearing. If no problems are picked up at this stage, they may be detected during routine checks as your child gets older. Hearing and vision tests for adults. In most cases, deafblindness develops as a person gets older. It can happen gradually, so you may not notice that your vision and/or hearing are getting worse at first. It's therefore important to have routine eye tests to check for any problems. Adults should normally have their eyes tested every 2 years. You can request a hearing test at your GP surgery at any point if you think you may be losing your hearing. A person may be diagnosed with deafblindness if tests show they have both hearing and vision problems. Their hearing and vision should continue to be regularly assessed even after they've been diagnosed, as the level of care and support they need will depend on how severely each sense is affected.
Managing deafblindness. It's not always possible to treat the underlying causes of deafblindness, but a range of care and support services is available to help people with the condition. Most deafblind people will still have some hearing and/or vision. The level of care and support they need will depend on how severe their hearing and vision problems are. Individual care plan. The individual abilities and needs of a deafblind person should be assessed soon after they're diagnosed. This will allow a tailored care plan to be drawn up. The care plan will aim to preserve and maximize any remaining sensory functions the person has. Teach alternative communication. Methods such as the deafblind manual alphabet see below help the person retain as much independence as possible. For example, by recommending they receive training to use a long cane or guide dog, or through the provision of a communicator guide for young children. Ensure their educational needs are met. Communication systems as deafblindness can make communicating by speech and writing difficult. Alternative forms of communication may be necessary. The main communication systems used by deafblind people include clear speech. Speaking clearly is one of the most effective and common ways of communicating with deafblind people who have some remaining vision and hearing. Deafblind manual alphabet, a tactile form of communication where words are spelt onto the deafblind person's hand using set positions and movements. Block alphabet, a simple tactile form of communication where a word is spelt out in capital letters that are drawn onto the deafblind person's palm hands on signing. An adapted version of British Sign Language BSL where the deafblind person feels what's being signed by placing their hands on top of the signer's hand. Visual frame signing, an adapted version of BSL where the signs are adapted to be signed in a smaller space to match the position and size of a deafblind person's remaining sight. Braille, a system that uses a series of raised dots to represent letters or groups of letters moved similar to Braille, but uses raised, adapted capital letters that are simpler to feel.